Do you find it annoying that your blood sugar rises after every meal? Are you feeling worn out and unsure if it will ever settle? This is the startling reality. Type 2 diabetes that develops early is not necessarily irreversible. According to studies, when the body's insulin response is appropriately reset, about half of those diagnosed within 6 years can experience remission. This has nothing to do with excessive exercise or starvation. It's about methods that address the underlying cause and have been validated by science. Decrease long-term difficulties, restore vitality, and lower HbA1c. Today, we'll reveal the scientifically supported strategies your body may use to take back control and combat diabetes from the inside out. Let's begin with the first. 1 is a notable reduction in weight. The most effective strategy for reversing early-stage type 2 diabetes is significant weight loss. Evidence from the 2017 DIRECT trial in the UK was enlightening. With planned, severe weight loss, adults with diabetes identified within 6 years could achieve complete remission. For 3 to 5 months, participants consumed a very low-calorie diet of about 800 kilocalories per day, which included nutrient-complete meal replacements, soups, and shakes to ensure that their protein, vitamins, and minerals were adequate to avoid deficiencies. Following this stage, food was progressively reintroduced in a planned manner with a focus on lean protein, high-fiber vegetables, and quantity control. The outcomes were astounding. The effectiveness of significant weight reduction was demonstrated by the fact that 46% of patients sustained total remission at 12 months, and 86% of those who dropped more than or equal to 15 kilograms did so. Fascinating is the underlying process. Insulin resistance is silently caused by fat that is deposited in the pancreas and liver. Even when blood sugar is elevated, the liver overproduces glucose due to excess liver fat interfering with glucose control. In the meantime, beta cell activity is compromised by pancreatic fat, which lowers insulin secretion. This fat is mobilized by rapid, substantial weight reduction, which returns insulin sensitivity and production to normal. Fasting glucose levels fall as soon as these lipids do. Cells react appropriately to insulin, and post-meal increases level out. Imagine your pancreas finally waking up from years of overburden and being able to interact with your liver and muscles to efficiently control glucose. Significant metabolic advantages were also seen by the participants. In addition to glucose control, there was a significant decrease in visceral fat and waist circumference, as well as improvements in blood pressure, triglycerides, and cholesterol. A sufficient protein intake helped to maintain muscle mass and promoted insulin-mediated glucose absorption. Since muscle serves as the body's largest glucose sink, the organized method reduced the loss of lean tissue, which is crucial. Your metabolism stays active while you lose fat without losing muscle, which speeds up remission and makes gains long-lasting. The psychological and emotional effects are just as noticeable. Numerous individuals reported feeling more in charge of their health, having more energy, and feeling less tired. Long-term lifestyle adjustments are easier to achieve when early success encourages adherence. In the USA, structured programs and clinics offer supervision to guarantee safety, particularly for elderly or ill individuals. Because abrupt calorie reduction without supervision might strain the kidneys or cardiovascular system, especially in those with high blood pressure or renal issues, medical supervision is essential. The procedure is accurate. Participants ate 3 to 4 meal replacements a day throughout the 800 kilocalories per day phase. Each meal replacement was thoughtfully crafted to include 20 to 25 grams of protein, vital vitamins, and minerals, as well as non-starchy vegetables. Food was gradually reintroduced after 3 to 5 months, with daily instructions to avoid refined carbohydrates and to prioritize foods high in fiber and low in glycemic Rapid weight loss combined with cautious food reintroduction retrains the body's glucose management mechanism, lowering beta cell oxidative stress and insulin demand. The intervention's timing is crucial. The direct study made clear that, in order to prevent excessive beta cell damage to the pancreas, remission is best achieved during the first 5 to 6 years of diagnosis. Fasting glucose and HbA1c improved quickly for those who started early, often in a matter of weeks. Surprisingly, the experiment demonstrated a direct correlation between the degree of weight loss and the chance of remission, providing patients seeking reversal with a clear evidence-based goal. Bariatric surgery is number 2. One of the most effective and clinically validated ways to treat type 2 diabetes, particularly in obese individuals, is bariatric surgery. It is much more effective than lifestyle or medication alone, with numerous long-term studies routinely reporting remission rates between 60 and 80%. This goes beyond simply losing weight. It is a change in metabolism. Patients' blood glucose control dramatically improves in a matter of weeks, frequently before they lose a significant amount of weight. The trick is in how surgery rewires hormone signaling and reshapes the digestive tract, causing a series of alterations that specifically target insulin resistance. By mechanically changing gut hormone profiles, specifically those of GLP-1, peptide Y, and ghrelin, treatments such as gastric bypass and sleeve gastrectomy enhance insulin secretion and decrease appetite. This hormonal change stabilizes post-meal increases, reduces fasting glucose, and improves insulin sensitivity. At the same time, pancreatic beta cells start to work more effectively and hepatic insulin resistance decreases due to the quick loss of visceral and liver fat. Both of the main issues with type 2 diabetes are addressed by this combo. Insulin resistance and decreased secretion. Bariatric surgery results in significant and quick weight loss, frequently surpassing 25 to 30% of body weight in the first year. Alongside glucose control, this results in changes in lipid profiles, blood pressure, and inflammatory indicators like CRP. Triglycerides decrease, HDL cholesterol increases, and cardiovascular risk factors improve. Real-world data from the USA indicates that even patients with diabetes who have had the disease for more than 5 years can go into partial remission, especially if their pancreas still has some beta cell function. Beyond hormones and fat loss, bariatric surgery has a major impact on gut flora and nutrition absorption, which promotes metabolic health even more. Changes in gut flora promote the synthesis of short-chain fatty acids, which reduce inflammation and aid in the metabolism of glucose in the liver. Additionally, patients naturally cut back on calories and desires, especially for meals high in sugar, which helps to maintain long-lasting remission. According to studies, after attaining long-term weight loss, many people stop taking insulin and other glucose-lowering drugs within months, sometimes permanently. One cannot undervalue the psychological influence. Improved energy, mobility, and mental clarity are reported by patients, which promotes the adoption of healthy behaviors. Patients who have smaller stomachs eat more foods high in protein and nutrients, which improves insulin sensitivity even more. The best results are guaranteed and vitamin B12, iron, calcium, and vitamin D deficits are avoided by following post-operative dietary recommendations, which include high-protein meals and vitamin supplements. To sustain remission and prevent complications, a multidisciplinary team's long-term follow-up is crucial. The metabolic advantages of various surgical techniques vary slightly. While sleeve gastrectomy results in substantial weight loss with fewer hazards and simpler nutrient absorption, Roux-en-Y gastric bypass gives robust early remission because of more profound hormonal alterations and nutrient rerouting. Both strategies lower fasting glucose, raise total metabolic flexibility, and improve HbA1c, according to studies conducted on American populations. Even in patients with obesity-related complications like obstructive sleep apnea or non-alcoholic fatty liver disease, gastric bypass surgery improves oxygenation, lowers systemic inflammation, and reduces liver fat, all of which contribute to improved glucose metabolism, even though it frequently produces a faster remission. Despite its great effectiveness, bariatric surgery carries some hazards. Long-term monitoring is essential to avoid nutritional deficits, gallstones, or weight gain. Short-term consequences can include bleeding, infection, leakage, or problems connected to anesthesia. To maintain remission, structured follow-up programs that prioritize protein consumption, vitamin supplements, and the progressive reintroduction of complex carbohydrates are essential. Monitoring lipid profiles, liver function, fasting glucose, and HbA1c on a regular basis guarantees that metabolic gains last for many years. Bariatric surgery has the highest known rates of remission for Americans with obesity and poorly managed type 2 diabetes. It is a genuine metabolic intervention that restores the body's natural ability to regulate glucose by establishing a physiological environment. It is the best evidence-based strategy for restoring insulin sensitivity, achieving long-term remission, and significantly enhancing overall metabolic health in individuals with poorly managed diabetes or a BMI of 35 or above. It's more than just a process. It is a complete metabolic solution supported by hundreds of studies conducted globally and decades of clinical data. 3. Ketogenic and low-carb diets. One of the most effective clinically proven strategies for reversing early type 2 diabetes is a low-carb or ketogenic diet. The Verta Health study, which tracked more than 300 patients in the U.S. from 2017 to 2023, yielded some amazing results. 54% of individuals experienced diabetes reversal within 2 years, which is defined as an HbA1c reduction below 6.5% without the use of drugs other than metformin. Many patients were able to stop taking insulin entirely, and the average HbA1c decreased from 7.6% to 6.3%. These figures go beyond simple statistics. They show a significant metabolic reprogramming. It's an interesting mechanism. Cutting back on carbs significantly reduces the body's need for insulin, which relieves the strain on the pancreatic beta cells. Post-meal surges are reduced since blood glucose increases more gradually. Visceral and hepatic fat levels, which are key causes of insulin resistance, quickly decrease as a result of the liver ceasing to store extra fat. The body switches to burning fat for energy when glucose availability is restricted, creating ketone bodies that give off a consistent energy source without raising insulin levels. Additionally, this procedure increases GLP-1 release, which enhances satiety and insulin secretion. Losing weight is another important factor. Participants in the Vera Health cohort saw significant, long-term weight loss, which improves insulin sensitivity. Significant drops in HbA1c were achieved even with modest weight loss of 5 to 10%. However, reversal rates are highest among individuals who lost most and closely followed carbohydrate limitations. In contrast to calorie-restricted low-fat diets, patients reported increased energy, less sugar cravings, and fewer hypoglycemia episodes, making diet adherence more sustainable. The dietary strategy places a strong emphasis on moderate protein intake, high-quality fats, and very little carbohydrate, typically less than 50 grams daily. Fatty fish, eggs, avocados, leafy greens, cruciferous vegetables, nuts, seeds, and low-carb veggies are among the foods. Healthy fats lower inflammation, a major cause of insulin resistance, whereas protein promotes the maintenance of muscle mass and increases GLP-1. Omega-3 fatty acids, especially those found in salmon and chia seeds, lower hepatic fat, enhance lipid profiles, and protect the pancreas. Controlling electrolytes is essential. Magnesium, potassium, and sodium levels may decrease during the initial adaptation phase, leading to cramping, weariness, and lightheadedness. Patients are frequently counseled to keep an eye on their electrolytes, drink plenty of water, and take supplements as necessary. Safety, energy stability, and optimal metabolic response are guaranteed by this close attention. Results are improved by continuous glucose monitoring, which gives patients a psychological boost in behavioral reinforcement by enabling them to observe the real-time effects of each meals on blood sugar. Ketogenic diets reduce cardiovascular risk by improving blood pressure, triglycerides, and HDL cholesterol in addition to glucose. Visceral fat decrease is common in patients and is strongly associated with beta cell stress, fatty liver, and systemic inflammation. Additionally, research indicates that the diet promotes cellular energy efficiency, fatty acid oxidation, and mitochondrial activity, all of which create a metabolic milieu that is detrimental to the progression of diabetes. Results are amplified by behavioral assistance. Patients receive structured meal planning, daily coaching, and education on nutrient timing, carb counting, and flexible eating out techniques. These programs incorporate accountability, habit formation, and psychological support, all of which are essential for sustained adherence. Higher remission rates and long-lasting HbA1c improvement are directly correlated with coaching involvement, according to Vera Health data. Reducing pharmaceutical reliance is one of the long-term advantages. In order to improve quality of life and lessen adverse effects, several individuals stopped taking insulin, oral hypoglycemics, and even GLP-1 receptor agonists. This is not a short-term solution. The underlying metabolic imbalance that leads to type 2 diabetes is reversed. Crucially, ketogenic diets, which rely on readily available, reasonably priced products, are feasible for daily life in the United States. Simple recipes, meal planning, and home cooking make sustainable implementation possible. The backbone is provided by common foods like eggs, poultry, leafy greens, avocado, salmon, almonds, and olive oil. The flavor is enhanced by spices and herbs without increasing blood sugar levels. By reducing insulin demand, lowering visceral and liver fat, improving insulin sensitivity, and stabilizing energy levels, this dietary strategy can radically change metabolism in early type 2 diabetes, when pancreatic beta cells are still salvageable. Ketogenic and low-carb diets target the underlying cause of the illness. 4. Lifestyle interventions that are intensive. Reversing early type 2 diabetes by intensive lifestyle treatments has been clinically proved to be effective, particularly for individuals diagnosed within 2 years when the pancreas and insulin pathways are still sensitive. One of the biggest studies on diabetes and lifestyle in the United States, the Look Ahead trial recruited more than 5,000 people with type 2 diabetes and followed them for nearly 10 years. It proved that structured programs that incorporate behavioral coaching, physical exercise, and nutritional changes can result in quantifiable improvements in weight, glucose control, and metabolic health. The experiment showed that a considerable percentage of individuals might achieve partial remission and clinically meaningful improvements, even if full remission was less common than with bariatric surgery or extremely low-calorie diets. The intervention placed a strong emphasis on dietary changes, reducing consumption of refined carbohydrates and sugary snacks and increasing consumption of lean protein sources, high fiber, low glycemic meals, and healthy fats. The participants were told to keep their daily caloric deficit between 500 and 750 kilocalories below their projected needs in order to lose 5 to 10% of their body weight throughout the first 6 months. According to research from Look Ahead, even a small amount of weight loss increases insulin sensitivity, reduces abdominal fat, and lowers fasting glucose levels by an average of 20 to 30 milligrams per deciliter. Improvements in HbA1c for those who continue to lose more weight vary from 0.7 to 1.2 percentage points, which is sufficient to lower medication requirements and occasionally permit stopping insulin or sulfonylureas under a doctor's care. Exercise was a key component, with individuals doing resistance training 2 to 3 times a week in addition to 175 minutes of moderate-intensity aerobic activity such as brisk walking, cycling, or swimming. Even without insulin, this dual strategy improved glucose absorption by increasing skeletal muscles' GLUT4 transporter function. During weight loss, resistance exercise also maintained lean muscle mass, which is essential for sustaining insulin sensitivity over the long term and lowering metabolic rate. Exercise also decreased hepatic and visceral fat, reducing inflammatory indicators that are directly associated with developing insulin resistance, such as CRP and IL-6. Another important factor was behavioral support. In order to assist them overcome obstacles including emotional eating, social temptations, and plateaus, participants got weekly coaching, group sessions, and individualized therapy. Look forward. According to the data, those who closely followed behavioral techniques were twice as likely to experience partial remission as those who did not. Goal setting, food journaling, problem-solving techniques, and stress management were among the methods used. All were intended to establish long-term lifestyle habits as opposed to band-aid solutions. These improvements have a variety of physiological processes. Losing weight lowers visceral adiposity, which in turn lowers circulating free fatty acids and hepatic glucose production. Beta cells can resume normal insulin release when there is less fat in the pancreas and liver because it lowers inflammation and cellular stress. Glycemic variability, which is closely associated with vascular problems in diabetes, is decreased by improved skeletal muscle glucose absorption and decreased post-meal glucose spikes. Blood pressure, cholesterol, and renal function were continuously monitored to further guarantee safety and assist in customizing the intervention for high-risk individuals. Even if weight reduction plateaued, long-term commitment to these lifestyle changes produced long-lasting metabolic improvements. Compliance was strengthened by the participants' reports of increased energy, less post-meal weariness, and less cravings. Postprandial glucose excursions were reduced by focusing on the time and composition of nutrients, such as a high-protein breakfast, a lunch high in fiber, and a dinner high in healthy fats. In people using insulin or sulfonylureas, small, frequent meals maintained satiety and reduced stress on pancreatic beta cells, preventing hypoglycemia. Crucially, the study showed that intense lifestyle treatments may be scaled up and adjusted to fit actual U.S. environments. Look-ahead-inspired clinics, community centers, and online initiatives have repeated outcomes by offering systematic direction, responsibility, and continuous assistance. To ensure inclusion without sacrificing safety, low-impact aerobic exercise, seated resistance training, and flexibility exercises were promoted for seniors and people with mobility impairments. 5. Time-restricted eating or intermittent fasting. One possible method for reversing early-stage type 2 diabetes is intermittent fasting or time-restricted eating. 3 non-consecutive fasting days per week significantly improve blood sugar control and, in certain cases, lead to partial remission, according to clinical observations, including a 2018 BMJ case report series. The idea is straightforward but effective. By extending the fasting window, insulin spikes are less frequent and less severe, allowing pancreatic beta cells to rest and repair. The body starts to release fat from the liver and visceral reserves, which are the main causes of insulin resistance, when there is less insulin in the blood. The metabolic processes are convincing. Hepatic fat content decreases during fasting as the liver transitions from glucose production to fat oxidation and gradually depletes glycogen stores. Fasting glucose can return to normal when liver fat is reduced because it directly increases hepatic insulin sensitivity. Pro-inflammatory cytokines such as TNF, alpha, and IL-6 are also released less when visceral fat is reduced. These cytokines are closely related to poor insulin signaling in muscle and liver tissue. As a result, there is less noticeable post-meal hypoglycemia and more effective glucose absorption throughout the body. Additionally, time-restricted eating aligns food consumption with circadian rhythms, which studies indicate are essential for metabolic health. Endogenous insulin secretion is increased when it's most needed when eating within an 8 to 10 hour window and fasting for 14 to 16 hours overnight. This improves skeletal muscle and insulin sensitivity and increases GLP-1 activity. Even without rigorous calorie restriction, small clinical studies in the U.S. have shown modest weight loss, a drop in fasting glucose of 15 to 25 milligrams per deciliter, and a reduction in HbA1c of 0.5 to 1% within 8 to 12 weeks. Under medical supervision, several patients were able to reduce or stop taking drugs such as sulfonylureas or metformin, demonstrating the clinical potential of fasting for type 2 diabetes in its early stages. Alternate day fasting, 5 to 2 fasting days, 2 low-calorie days per week, or daily time-restricted eating, where the first meal starts late in the morning and the last meal concludes early in the evening, are common practical regimens. Only non-caloric drinks like water, black coffee, or unsweetened tea are permitted during times of fasting. According to new research, lean muscle mass is preserved and insulin sensitivity is further improved when moderate resistance training is combined with fasting. When fasting windows are introduced gradually, starting with 12 hours and increasing to 16 to 18 hours over a few weeks, compliance is higher. It is essential to intervene early. People who are diagnosed 5 to 6 years before widespread pancreatic beta cell malfunction occurs seem to benefit the most from intermittent fasting. Patients with fatty liver or visceral obesity benefit most from treatment because they frequently see the biggest decreases in hepatic and visceral fat, which is closely correlated with reductions in fasting glucose and HbA1c. For patients on insulin or sulfonylureas in particular, monitoring by a healthcare professional is crucial in order to prevent hypoglycemia and properly modify dosage. The consistency of outcomes across smaller trials and case series is striking, even though large-scale randomized control trials are still limited as compared to direct or conversa health investigations. Beyond glucose management, participants report other advantages such as decreased hunger, increased energy, better sleep, and decreased systemic inflammation, all of which contribute to metabolic resilience. The psychological impact is also noteworthy. Since intermittent fasting makes everyday decisions easier and gives people a sense of control over their eating habits, many people find it easier to follow than continuous calorie restriction. Imaging studies demonstrating a 30% reduction in liver fat and a decrease in visceral adiposity after weeks of fasting implementation further corroborate the mechanistic findings. Improved insulin receptor sensitivity in the liver and skeletal muscle is mostly due to this fat loss. Increased insulin sensitivity minimizes the risk of microvascular problems, oxidative stress, and the necessity for hyperinsulinemia.